A warm welcome to everyone to this webinar from the Good CME Practice Group on the power of social media in CME. Social media is being used more and more in CME, mainly as a communication platform to make our audiences aware of existing programs, but some programs are now also hosted on social media itself. My name is Froukje Sosef. I'm the co-founder and medical director of Core2Ed, a company in independent medical education. And as Core2Ed, we are a proud member of the Good CME Practice Group. With me today are Sophie Wilson from International Medical Press, who's also a member of the Good CME Practice Group. And then we have guests from the other side of the Atlantic. From the CME Coalition, we have Seth Whitelaw, who's the president and CEO of Whitelaw Compliance Group, and Thomas Sullivan, Senior Vice President of Educational Strategy at Clinical Education Alliance. We're very pleased to have both Seth and Tom joining us, since in December of 2023, the CME Coalition published their social media compliance guide. And we're very much looking forward to this discussion with you and gain more insights on the do's and don'ts when it comes to using social media in IME. At both International Medical Press and also at Core2Ed, we use social media as part of the educational activities, so we can bring in some practical examples as well. Okay, so let's start. Tom, maybe with you. If you could provide us a bit more background, tell us a little bit about the CME Coalition. And then when we talk about social media, to set the basics, which are the platforms that you consider to be included?
Well, thank you. Thank you very much. And I appreciate being able to address everyone in what sounds like a quite global audience. The CME Coalition, which was founded in 2011, is a policy and development advocacy organization composed and representing continuing education CE providers, supporters, and beneficiaries. We represent many of the leading CME providers and supporters in the CME enterprise. Our member organizations range and manage the support of development of CE professionals for about 1 million physicians, nurses, and pharmacists in the United States. And also many of our members are involved globally in addition. But we're really an advocacy organization. And over the past 2 decades, beginning with the launch of Facebook and Twitter, now rebranded as X, social media, like the internet, has emerged as an essential global communication channel for healthcare stakeholders. And simultaneously, we've seen numerous questions arise over how do we use social media? What are we allowed to do? What are we not? And that's really was the gist of the social media compliance guide. We're going to be talking a lot about that. Seth's going to be going into a lot of detail. The guide was developed by a working group of about 10 people that were from member companies of our coalition. We also received support for the guide from Otsuka Pharmaceuticals, Medscape, and MedIQ, as well as the CME Coalition put funds in toward this guide. So it's a very important document. Now, to your question of what is considered social media, we'll think about Facebook as something was kind of the first, I believe, social media platform with wide adoption. Right now, there's about 3 billion people that use Facebook, but other platforms like YouTube, WhatsApp, Instagram, LinkedIn, TikTok, WeChat, Facebook Messenger, Telegram. For those in China, Douyin, Kashui, Sina Weibo, QQ are some of the platforms, but also Snapchat. X obviously is quite an important platform, especially in communicating messages. A lot of CME programs actually in the United States have been done, accredited programs have been done on X, which used to be Twitter. So if, in case you're not up on the new, I think Elon Musk likes to call everything X, so everything is kind of around his X universe. But Pinterest, there's no shortage of social media platforms that are available. I think and each one has a unique opportunity to be able to engage users. and we'll go into that in a lot more detail about some of the things that happened, for instance, during the pandemic that really made social media very much an active part of everyday life for the world, because people were, kind of stuck and nowhere else to go. And so, and since then it's become sort of it's actually much more used now than it has been, not as much as during the pandemic, obviously, but it's still quite a lot of users. So, thank you.
Thank you, Tom. Thank you. And then Sophie, to bring this to practice, how do you use social media at the International Medical Press? How do you reach your audience? How do you engage with them? What's your experience?
Thank you, Froukje, and good morning, good afternoon, everybody, wherever you are. I'm Sophie Wilson, and I work for International Medical Press, a CME provider in the Inisio network. And full disclosure, IMP received grant funding from industry, but also from foundations and societies and other organisations. So, like CME, we're also proud to be part of the Good CME Practice Group. Coming to social media, well, we've used social media as a tool, as a promotional tool for many, many years. As Tom said, Facebook has been around a long time, but also LinkedIn, YouTube, Twitter. They're all great for audience generation. But how can we use them for education? So we started asking ourselves that question more and more 3 years ago as we were coming out of the pandemic. And with our sister company, the International Institute for Medical and Nursing Education, we started experimenting with social media as an education, as opposed to promotional platform. And we've been testing the waters with YouTube and tweetorials on X. I can't call them X-torials, so they're going to stay tweetorials on X for me. The uptake has been very positive. In the first 2 weeks of a tweetorial campaign, we get 500 to 600 unique engagements. These are great statistics. You don't get as many people at a satellite symposium live these days. For some tweets, we have nearly over 800 learners. And this engagement was sustained in this program of tutorials that we've been running recently. It wasn't just that the first one was a novelty and we got lots of people. No, we've been getting the same sort of engagement, 700 people in the first weeks after launch, in the second, in the third, in the fourth tutorial of a series. So people like it. People are coming back. They're engaging. Now what we need to do is work on how do we track that engagement? How do we evaluate what learning is happening during that engagement? And that's, I think we'll talk on about a bit later, Froukje. And I think, Froukje, you at Core2Ed, you've used different types of platforms as well in a different way.
Yeah. So at Core2Ed, we also use social media for the promotion of our educational programs. But recently, we also started, like you, doing educational activities on social media. The platforms that we use are mainly X, LinkedIn, and YouTube. But we have also used, and it depends on the demographics of the target audience we want to reach, platforms like TikTok, Instagram. We've also done tutorials, and I agree with you, Sophie. The reach is amazing. The engagement is amazing. The number of views we have on those tutorials, which were patient case based, was really high numbers. And actually, the tutorials we did them on X, so tutorials on X, like you, but also sort of transform them as tutorials on LinkedIn. So I think it's a great way to engage our learners who are keen to use social media. Okay, so Seth, welcome, over to you. So when developing the social media compliance guide, what was your main objective? Tom already touched upon it, but can you tell us a little bit more?
Sure. The main objective of the social media guidance was to create an accessible and user-friendly guide to allow people that wanted to use social media in the medical education context to understand the crucial considerations that go into the decisions around its use. So it's a emerging and complicated area, and we were trying to make it such that, you know, if you had questions, you could go there and perhaps get answers, or certainly things that you should be considering as you move forward. Part of that, as Tom alluded to, you know, we work in a global environment. We have global providers. So we drew from both what we knew in the US as well as what was coming out from Europe and wherever else we could source guidance from the regulators, to try to put that together and see if we could see a pattern or a trend, which I think in most parts we have seen those trends and patterns.
Thanks, Seth. Thank you. And I think in the social media guide, it will come to that. It's sort of what to pay attention to in terms of risks. But Tom, from your view, what are the benefits of using social media to communicate on CME programs?
Well, I think you covered it well before, which is reach. That you get a lot more people when you do social media education platforms. I have a good friend, Howard Ho, runs a company called P2P that gets about 20 to 40,000 people on YouTube, for instance, when he does his education programs. We have seen just a lot of people, again, like I said at the beginning, there's just a lot of people using different media platforms. And you know, it's interesting, there's in places like India, there's 114 million people using LinkedIn in India. So that's actually a very good platform for like India, right? You know, if you're trying to reach the Indian market, there's just a lot, they're very engaged, they're very much about building their careers. So there's so many different niche areas, depending on where you are in the world, that you can reach different medical professionals. When the pandemic hit, there was a real need for nurses around the world, and it was because they were available on Facebook and they were part of Facebook groups that were able to move some of our staffs around, at least in the United States. You know, there's doctors that are there's one Facebook group with about 105,000 doctors on it that you know, so if you want to message out to the physicians, that there are Facebook groups that have, you know, just large communities. And what they've done is they've built these social media channels, have built these huge communities that we as CME providers for both reaching them for our you know, advertising our online content, but also, you know, reaching them for getting, like you said, tutorials and YouTube posts, and, you know, thinking of it as more as extra engagement. Now, the challenge you have in social media is being able to control the audience, right? You know, because things can go, you know, things can go all over the map. And the other piece that you have is that is getting statistics that are you know, how many doctors answered this question, or how many nurses answered this. Some of this is a little bit more difficult, but I think eventually it's going to get there. So I think this is not a media that we go, oh, it's just in the future, or it is now, and it's very, very active.
Thank you, Tom. Thank you. So those are the benefits. Of course, there are also risks. And Seth, I would like to ask you that question. What are the risks? What is it we all need to pay attention to when using social media in CME?
Well, I think the risks can be divided into two categories. There are the traditional risks that we've always had with medical education, like transparency and accuracy. That has not changed. It's just a different venue. I think there are some really unique challenges with social media, which we've covered, such as, you know, how do you deal with social media that have character limitations, for example? How do you deal with the third-party platforms, Facebook, Twitter, or, you know, LinkedIn, how do they capture data? How do they capture attendee data? How is that used? So there are privacy concerns that go along with that. And you're not working with a platform necessarily that you built. You're working with a commercial platform that's designed to go across different industries. But I think the most significant risk for anybody using social media in the medical education context is making sure that whatever you do and however you use those platforms, that you do not compromise the integrity and independence of the education. That is first and foremost. So I would always start with that question.
Thank you. That's very clear. Okay. Now, last question, before we go into sort of the submitted questions, we see questions coming in. Great. But what I would like to cover is the measurement of educational outcomes on social media, which is a challenge. And Sophie, you already alluded to it as well. Sophie, which are the metrics that you use when hosting an educational program?
Yeah, I think Seth touched on it. You know, the difficulty with social media is you're not working with your own platform. So you can't define the metrics. You have to use the metrics that are available and supplied in the format that they're available and supplied by the platform that you're using. And so that is a challenge. And so the metrics will be different depending on the platform. But so it is a challenge. It's something I think people need to realize is it's very different to traditional CME. This is learning on the go. It's not just bite size, it's micro size. So with our tutorials, we definitely, as Froukje did, have great engagement, big numbers. But the but is doctors, HCPs don't seem to be interested in doing the CME evaluations and getting the certificates. So compared to traditional CME, the number of traditional completers is lower. But that doesn't mean that the education is not useful or good. So we're looking at how we're working on incorporating our evaluation on the go as well. It's education on the go. People want it to be able to do it as they're sitting on the bus, as they're sitting on the train, podcasts in their commute. So the evaluation needs to be on the go too, I think. And we're using polls, for examples, but then you get platform challenges. On Twitter, a poll is only live for a short amount of time. And if somebody doesn't do the poll in the first, I think, 2 weeks after launch, the poll's gone, the poll's closed. And that's not us, that's the platform. So there's a lot of challenges like that. And, you know, we can repost, but that's not ideal. So we do need to be looking at what different metrics we can measure. It's very different to 30 to 60 minutes. We're currently looking at outcomes that we can collect, and we're trying to look at what they mean in terms of learning. And those metrics might be retweets. If somebody retweets something, it means that they've engaged with it. Comments, learner posts and comments, conversations initiated. So we're trying to get our faculty to, you know, review, but then they're not always social media gurus themselves. So we want them to review, feedback, comment on what the learners are commenting, and getting that engagement going, that conversation going. So that's what we're trying to do at the moment. But it's a moving feast. I don't think anybody will have an answer. We'll all probably give you a different answer. And it would be great to hear what other providers are doing. Thank you,
Sophie. Yeah, and this was also a question that was asked. So indeed, how to unify metrics, indeed, engagements can be unified. Seth, Tom, any thoughts from you on this, on measuring outcomes?
What we have seen is the same with Sophie is at Clinical Education Alliance is when we've done these that we've had, and some of our members, I see a bunch of them on the call today, that you know there is a difficulty measuring, but it's a great, these are, you know, your level of engagement is significantly higher. And again, like I said, when we're talking about our guide, this is just to help us know what our guardrails are. right? I think, Seth, you didn't really go into any details, but I'd like you to, if you could just talk about one or two of the guardrails that you think are important, that we put into that guide. There's so many hours. I can't thank enough the committee that put this together, because there was just so many hours of work. So Seth, I don't know.
Well, a guardrail that we talk about is, how do you make sure that you're only the people that you want to attend programs are actually the ones who are coming into the program. And there really is no bright line, and that's part of the challenge that we have. A couple of ways to do that are use a social media platform where you actually can control the parties that are admitted or not admitted, so that they register in advance and you allow only those people in. If you're working on a social media platform, for example, where you can't do that, you're kind of stuck with the way pharmaceutical companies have handled the internet for years, is that they have an area that is for healthcare providers, and then there's an area for patients. And yes, a patient could potentially get into the healthcare provider area, but you actually have to affirmatively click and attest that you are a healthcare provider. So at that point, it's not a fail safe, but at least you have some level of protection that the person who gets in there, if it's a patient in the healthcare provider section, for example, is having to misrepresent who they are in order to be allowed in. But there are no, again, there are no fail safes around it. The same thing with privacy, Tom. We spent a lot of time discussing getting consent and putting the appropriate disclaimers on how the information is captured and utilized. And we talk a lot about the need to review the platform's terms and conditions. You need to know that up front before you engage and use that platform, so you know exactly how it's going to work, what's going to be captured, are there opt-out provisions, etc. So those are just a couple of the examples, but the guide is fairly extensive. And another area that we spent a lot of time talking about was, how do you deal with the challenge of misinformation? Somebody puts a random post up, do you address it? Do you not address it? There's no real requirement that you have to address it, but there are certain considerations, and we go into them in detail about, well, if you're going to respond, what's the best way to do that?
Yeah, thanks, Seth. Somebody's asking about sort of having a link to the compliance guide. So I think that's being provided right now in the Q&A section. So it was also in the invitation email for this webinar. One question, well, there are a couple of questions that came up in the Q&A section, which I would like to combine. One is, how do you make sure that you reach the appropriate audience, so the right specialty for your educational activity? And the second question is, what is the best length of time for an educational activity on social media? Of course, that's not 1 hour, like a traditional e-learning, but what's the optimal length that we can have? Who would like to take that question? Sophie, Tom, Seth?
I can talk briefly about, how do you reach the right audience? Well, I think it was said earlier, you need to look at social media. It's just another venue, so in a convention centre, you don't know who's going to register for the conference, but if it's a diabetes conference, you assume that it's going to be people interested in diabetes. So, for our social media campaigns, we start with social listening. We listen to see where people are going on social media, what they're looking for, where the right conversations are happening for our particular topic. And we normally start with medical societies, perhaps the Congress website, and faculty networks. And it's really a question of experimenting, of listening. It's the same way as when you decide which conference shall I organize a symposium at. You have to do that research. And we also use learners from previous programs.
Yeah.
So it's a whole mix. And in
I
terms
would-
of length of time, I would say 18, maximum 18 minutes, but probably a lot shorter. A lot shorter, probably 5
Yeah.
minutes, 4 or 5.
I had the opportunity to look at data from many programs, and the learner drop off after the first 5 minutes is pretty significant on social media. So especially like on YouTube, like if you see a chart, it goes like this, and then it goes like almost straight down and then flat lines after about 5 minutes. So you need to get your message out quicker. You need to get your education out quicker. Think of smaller bites. Think of like less time that you're spending. You're spending more time thinking about how to speak shortly. It's like almost like making a television commercial, right? You know, your a telecommercial. You have 30 seconds to get your message out. What can you do in that 30 seconds? And so it's, again, your shorts, and it depends on the platform. Like Snapchat is, you know, I think they're 20, 30 seconds max,
Yeah.
right? You know, like, so it, or TikTok is like these little itty bitty short messages. So think about, how do we take the same message and just divide it up into lots of small bites?
And
Thank
another
you.
way,
Oh.
is know your platform and know the hashtags. Hashtags are another way that you can reach various groups. So
Yeah.
if people are following a certain hashtag, you are more likely to reach them. So again, a large part of this and a large part of the guide is about, you need to do your homework.
Very good point.
And
Thank
I
you.
would say that you probably want to we have some really good experts in the CME Coalition that live and eat and breathe social media, and I'll be glad to offer them to you all for a future webinar. So I think there's a lot more to this topic.
Perfect. Thank you. We'll follow up on that. We only have 2 minutes left before this webinar closes. There's one important question about accreditation bodies. How do you have any experience on how they deal with education on these platforms that we discussed? Maybe let's do it US and Europe.
Sure. So in the United States, the ACCME just released an FAQ about a month ago on using social media. A lot of the onus on that is on the accredited provider to determine if that platform meets the ACCME standards. The accreditors, by and large, have not known exactly what to do with this, but I think with that FAQ, at least in the United States, there'll be some instructions for the reviewers that this is how you evaluate a social media program that's been pulled as part of your survey. In Europe, because of privacy laws, it's very difficult. Because of GDPR, it's very difficult with social media, because you know, how do people stay private? And I've never been able to square the circle with GDPR and social media in Europe, but Sophie might have a comment on that. So
Sophie, you want to?
I think the privacy thing is a big thing. I'll be honest, we have our programs, our social media programs we've done with our US ACCME sister company, partly because ACCME will let you do much shorter pieces, whereas in Europe, you know, micro-learning is as long as 30 minutes, which, you know, is not going to work on social media. I mean, we're exploring with a couple of the accreditors in Europe about, you know, stringing together a series, and by capturing the time spent, doing credit that way. But the issue in Europe is there's GDPR, but also the accreditors at the moment don't really make it easy to do what I would call micro learning, as you know, micro learning as opposed to bite size.
Yeah. Thank you. This is the end. There are more questions. I think we do need to do a follow-up. Tom, as you mentioned, thank you, Sophie, Seth, Tom. Thank you all for attending and submitting so many questions. Have a nice day and see you next time. Thank you.
all.
Thank you.
Thank you.
Bye. Bye.